Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Eating disorders are psychiatric illnesses that can affect people of any age, gender, race, socioeconomic status, or culture. These conditions are not just about controlling food intake or weight. Often, they are linked to underlying issues like anxiety, depression, or past trauma. Robert Wood Johnson University Hospital Somerset is only one of 2 hospitals in New Jersey to offer inpatient care for the treatment of eating disorders. The hospital's eating disorders program is part of RWJBarnabas Health's Behavioral Health Services together with the Rutgers University Behavioral Health Care. On today's show, we will learn about risk factors for eating disorders, common signs and symptoms, how to help those who are struggling, and why it's important to detect an eating disorder early when it's easier to treat. We are pleased to welcome Christine DeSouza, Nutrition Coordinator for the Eating Disorders Program at Robert Wood Johnson University Hospital Somerset, and Amanda Bitterman, Lead Therapist for the program. Welcome to the show. Thank you, Amanda and Christine, for being here on the show. First, before we even start, can you just tell us a little bit about a background in both of you and what got you into the Eating Disorder Center over at Robert Wood Johnson University Hospital? First, Amanda.
Thanks for having us. I personally am a licensed professional counselor, so here I work as the lead therapist. Started off my career actually as an art therapist, decided to transition. Early on, I got into eating disorders in my undergraduate degree, had an internship at a residential program and just loved it. I personally, with eating disorders, like to see that there's a mental and physical change to the disorder rather than just anxiety and depression. So that's kind of when I got interested.
And Christine, a little bit about yourself.
Yeah, I've been in the field for over 25 years, and I did my undergraduate at UMDNJ and my graduate at Rutgers. And I've always loved nutrition. I started off as a nutrition tech about 28 years ago and working in the food and nutrition department, and the spot came open on the eating disorders unit, and I've been here ever since, and I love what I do.
Thank you. Thank you both for the little introduction about yourself. Eating disorders. A lot of people don't understand what it is. Can you give us a definition and even describe what the most common types of eating disorders are?
Yeah, so I can start off. So first and foremost, I know culturally we know anorexia nervosa. So this is when we see people engage in food restriction, have a lot of distorted body image, a lot of weight loss issues. Next is bulimia nervosa, which is the binge purge cycle. So individuals will increase their food intake and then engage in compensatory behaviors. So whether this is working out, throwing up, laxative abuse. Then there's binge eating disorder, which is similar in nature, but people don't engage in the compensatory behaviors. So it's when people increase their food intake. A lot of times there's weight gain involved. And then there's avoidant restrictive food intake disorder, which we hear about less often, but it's becoming more popular. This is when an individual struggles with sensory sensitivities. So a lot of times it's like texture related, smell, color, taste, that kind of stuff.
Thanks. And we're hearing more and more about eating disorders. Has there actually been an increased instance of eating disorders in adults and adolescents? And if so, what do you think the reasons are?
Yeah, it's unfortunate.
It certainly seems like it, right? I mean, and especially since the pandemic, I think that really was a turning point, and a lot of people on video, on camera, and being isolated, those seem to be significant factors in playing into the increase in eating disorders. We're seeing more and more acute patients that are more extremely ill. And this may be maybe pointing to not getting help as soon, or maybe some stigma going on. But yes, definitely, certainly seeing more incidences of eating disorders.
I'd also like to add, I think it's a lot, especially with adolescents, social media has become a very big factor to eating disorders. The nature of wanting to be accepted by peers, weight stigma, unfortunately, Ozempic and that stuff are more popular now. So we're seeing a lot of different kind of comorbidities and that kind of stuff.
Social media probably is a biggie. Everyone sees the Hollywood movie stars. They see Kim Kardashian and the Kardashian family. They see all of the singers, Dua Lipa and everyone else, and they see the size of them, and they're very put back that they don't look exactly like them, and that just sets a whole series of things off.
Yeah, and the thing with that is people don't understand that they have health, right? Their money can get them trainers and that kind of stuff. But unfortunately, the people who are normal every day are doing the negative behaviors, right? So restricting food intake and excessively exercising and stuff to reach those other expectations that we're seeing in the media.
And then, of course, as you said, with the pandemic, with everyone staying at home on Zoom, not interacting with other people, also increased that. They couldn't sit down and eat with each other.
Yeah, it was very isolating, especially for kids. This is a time when they need to be out with their peers, and they were just so, in their house, and there was minimal chance for interaction. So that was really a turning point.
What are risk factors for eating disorders?
So there's so many risk factors, and there's a combination of genetic, biological, psychological, social, environmental. So it's almost like there's no one particular cause, but it could be like the perfect storm to develop. So for instance, if someone is predisposed to having a family member who's had an eating disorder, that's a huge risk factor. And then along with that, if they're females are more likely to have an eating disorder. It's not always the case, but there's a high chance there. And then if they're going through puberty, or if they're, if they have psychologically, if they're less able to cope with stressors that come up. And then there's the social environmental, so like the social media, or moving away to school, or bullying, or life transitions. All of these kind of combine into this perfect storm where it exceeds the individual's ability to cope, and maybe they're less resilient to handling all of the stressors. So it's kind of like I said, the perfect storm to developing an eating disorder.
And are there common personality traits that are more common with people with eating disorders?
Yeah, we're seeing a lot of instances where like perfectionism plays a role, anxiety, low self-esteem, difficulty with emotional regulation, people-pleasing tendencies a lot of times, and then sensitivity to approval from others.
So again, social media has a lot to do with it.
Comparing unrealistic expectations from what they're seeing. And like Amanda said, right, who knows how many times they're taking the same picture to look absolutely perfect. And, a lot of people, we can't achieve that.
And why is it so important to detect eating disorders?
So unfortunately, people don't understand what eating disorders can do to our personal selves, right? It's not just the emotional part of things. Eating disorders affect so many physical aspects, and I know dietarily Christine can add on that, but it's to prevent severe medical issues, right, first and foremost. Improved treatment outcomes is way higher if we can catch eating disorders early. Reduce mortality risk, which is obviously the higher end of the spectrum. We don't want it to affect people's daily lives. So kids going to school, right? people going to work. If we can't function on a day-to-day, these things are going to be affected greatly. We don't see our family and friends as often if we're isolating, right, due to feeling a certain type of way about ourselves. So all these things are reasons for people to get treatment.
And again, it sounds a lot like a lot of that is suggestive of anxiety, depression.
Mm-hmm.
And all
Yeah.
what anxiety and depression can do. You know, one of the things that RWJBH has done is we've instituted the whole EPIC EMR, and in the EPIC EMR there is actually on one of the categories a whole thing all about food and eating disorders, and so this way, if someone is actually concerned about it, a primary care doctor, a specialist, they can actually put something in there and it actually start to move it towards someone recognizing that it may actually be an eating disorder and follow up afterwards.
Mm-hmm. Yeah, it's great. We try to help with screening tools, right? We try to create them ongoingly too, to help practitioners understand eating disorders. I've been doing a lot of outreach too, because the unfortunate nature is a lot of practitioners don't understand eating disorders or don't catch them early enough. So the screenings like you're talking about are super important to do early on and kind of flag, even if it doesn't reach the fact that they need treatment, at least we can kind of help with giving nutritional counseling, referrals for therapists, all the things that they can get.
Well, again, as part of EPIC, when I'm doing an annual wellness exam or a annual preventative exam, there is a good screening thing in there for food disorders. And even if it doesn't trigger the primary care specialist, et cetera, to do something, it is in red. And so it actually may key them to start to think maybe we need to make a referral to an eating disorder center.
That's awesome.
Yeah, that's amazing.
So what are the common signs of an eating disorder? Are there specific signs that parents should watch for in their teenagers or adolescents?
Definitely. So ideally, parents might pick up on signs that something is going on before it turns into a full-blown eating disorder. So parents know their children best. They're the expert in their children. So any overall change in demeanor, skipping meals, cutting out whole food groups, being more obsessed with dieting, reading labels, anything like that. And also like withdrawing from friends, things that they used to like to do, mood changes. So these things separately may not mean that there's an eating disorder going on, but it's certainly a red flag to kind of open the line of communication to talk to your child, like, hey, what's going on? Is everything okay? Just to get the communication going.
Anything to add, Amanda?
No, I think she hit a lot of it, especially not just even in adolescents, I think adults too, right? Is making sure that there's no avoidance in social situations or, again, sitting down at the table with a loved one, mood changes, OCD behaviors, all the things.
So if a parent or even friends are worried about someone, a teenager, an adolescent struggling, what are the best ways to start a conversation, and what questions do you think they should ask that person?
So definitely approaching it from a standpoint of care and concern versus judgment. So maybe not even talking about specifically with the food, but like I said earlier, hey, it seems like you're not doing okay lately. Is everything okay? Opening that line of communication. And then the child or family member may more likely be able to, not feel judged and be more open to sharing what's going on.
As with most things, open-ended questions, no judgment.
No judgment,
and basically
caring,
it's to
concern.
try to get as much out there as possible so that you could, basically it's almost like a screening. And this way you can try to hopefully figure out whether it is an eating disorder, whether it's anxiety, whether it's depression, or whether it's some other type of problem going on.
Yeah, I think that the unfortunate nature of eating disorders is it's a very secretive disorder, right? So it is important to have an open conversation instead of like the blaming conversation or the accusing conversation, because people tend to get defensive.
And again, if they get defensive, they back off, and then we're never going to figure out what's going on. And then even if we do figure out what's going on, the person's not going to want help.
Yeah, of course.
So again, when the holidays are upcoming, and of course that probably triggers a lot of this type of behavior. Food often plays a central role in the holidays: Thanksgiving, Christmas, New Year's. What are tips for navigating the holidays for someone who's at risk for an eating disorder?
So holidays are stressful, or can be stressful for everyone, right? But for someone who has an eating disorder, the food and diet and weight talk is everywhere. So definitely helping someone with support, planning ahead goes a long way. So planning ahead, keeping structured meal times, having a support person, just being open and caring, and maybe focusing on the real reason for the holiday and not so much on the food, having activities such as, I don't know, decorating or, putting up lights or those kinds of things, and not focusing so much on the food.
No, I wanted to add, I think the biggest thing is we call it like coping ahead. So again, like Christine was saying, is having a plan in place is super important, a safe space that we can walk away to, a safe person. The great thing now is we have our phones at our dispense. If we need to text a safe friend, just making sure that you feel good going into the meal and holiday in general can really help.
Of course, there's a lot of stress with family members, lots and lots of family members, people sleeping over, not sleeping in your normal area, not the normal times for things to happen. And the phones can be good or bad because the person can actually basically wall themselves off away from everyone else by going on the phone and going on apps and things like that, which actually is the opposite of what we really want them to do.
Keeping away from the isolating.
We don't want to isolate them. We want them to be part of everything. So can you describe, I've got someone who has an eating disorder, how a therapist and dietitian work together to help these people?
So all the team works together, but the therapist and dietitian are so collaborative, and we kind of build off of each other. So the dietitians will address the behavior change and establishing the structured meal plans and working to dispel the nutrition myths, whereas the therapy part, they address the psychological and the underlying aspects of what contributed to the eating disorder in the first place. So it's a really complementary, and we build off of each other.
And other members of the team, who are they and how do they work together with you guys?
No, we have a great team. I think that's why I love working here, because we do offer services that other programs don't. So we have occupational therapists, art therapy, music therapy, recreation therapy. We just got a yoga therapist. So we really kind of do want to look at the whole mind-body system. We have those people who can help in all the different ways. Also because sometimes there are people who rather talk into individual therapy, and there are people who rather express themselves creatively, right, to talk about how they're feeling. So we definitely love the team-based approach.
And what kind of levels of treatment are available? How do you decide what fits the patient's needs?
So we have inpatient, acute inpatient, we have partial hospital, and we have intensive outpatient. So when someone comes onto the unit for an evaluation, they meet with one of our staff members, and there's a comprehensive assessment and evaluation, and we determine the appropriate and most safe level of care based on the medical severity, the behaviors going on, and as well as like the support they have at home. So based on that, the team discusses and we decide what level of care is most appropriate.
And how do you work with families during the treatment?
So we do offer family therapy. This is a really important part of the treatment process, especially for adolescents, because right, mom and dad are making the food, mom and dad are going to the grocery store to get what their needs are. So we try to, again, use a collaborative approach, and the dietitians and the therapists meet with the parents or loved ones to give that education piece, right? What does my particular individual that I'm supporting need? So we kind of will go through how you can help them cope in certain situations, how food should kind of be presented in the house, how to support at the table, right, or in social situations. So we really try to keep them involved.
Nice. Is there academic support available for the teenage patients, and do you work with schools to help alleviate the concerns about them falling behind academically?
Yeah, because that's one thing. Parents come and they're like, I don't want my kid to miss school or fall behind. So the great thing about our program is we have teachers on staff. So for 2 hours a day, our adolescents will get to sit with a teacher. Their schools will send what work needs to be completed, but the teacher here will help them make sure they're staying on track and actually learning, right? Because it's very hard to teach yourself, especially when you're engaged in a program and kind of having those emotional dysregulation aspects involved as well. So they can meet with the teacher. Schools are great that they give the students a little bit of leniency in what needs to be done and the timeline. So we work with them in that nature. And our therapists are really in contact with the, whether social worker or the school, guidance counselor, teachers, to make sure that everything is taken care of.
Good. Good. This way the student doesn't feel, actually the parents don't feel bad about the student missing out on anything.
Yeah, because that adds more stress, and like that is not something we want them to be thinking about.
What support is available to patients and families after treatment to help them maintain their progress?
Yeah. We have a great support group for families here. There's also just so many online support groups, especially like we were talking about COVID. During COVID, that kind of boomed in the sense of, okay, how can we make this accessible to everyone? Which is a lot of times easier for families because obviously you're coming home from work at 5 p.m. How are you going to make it somewhere else before we have to cook dinner and stuff? So NIDA has a great support group opportunity, but we do allow our patients and families to come to us even post discharge for support.
Nice, because this way keeps the progress going.
Yeah. Continuity of care is really important.
The eating disorder unit recently underwent a renovation. Can you describe the changes and how they help create a space that promotes healing?
Yeah, we went from a 14-bed unit to a 20-bed unit. We have dedicated spaces for adults and adolescents. So that in itself creates their own safe space to express themselves and to go about their treatment while they're here. The overall program environment is very calming, and the lighting is so that it kind of matches the circadian rhythm throughout the day. So in the morning with the sunrise and the evening with the sunset. So it's really conducive to healing and, promoting good sleep patterns. The architecture itself is like there's a lot of curved lines, and there's the coloring is just very calming and soothing, and it really promotes that overall well-being and calming that's conducive to the recovery process.
So I'm a primary care physician, and I've got an 18-year-old in my office who I'm seeing who I think may have an eating disorder. What are the steps that I should do, and what are the steps I should tell the parents, et cetera, to do in order to get them into the eating disorder center and to get everything going?
So we have an access center, right? So we have a basic line for any individual to call that a practitioner can provide to them. After that, they will set them up with a triage appointment, which is what Christine was talking about, and that they'll meet with one of our staff members, get evaluated for level of care, and then we'll provide to them their next kind of steps, right? Their needs, whether it's inpatient or outpatient.
So I give them a telephone number, they call, they speak to a nurse navigator who gets them into the program, and they get an interview, and the interview will make a decision whether it's inpatient or outpatient services, and then the whole team gets together with the patient, the family, to start the process going. They go through the process, and they hopefully improve, and then they're either discharged or they're followed up as an outpatient. And you said you had that follow-up outpatient also.
So we have a support group. We're not right now set up for outpatient services just yet, but for discharge, we set them up with a therapist and a dietitian who can see them outpatient. So we try to keep it that they're seeing someone at least once a week still.
And hopefully you accept most insurances in the area, so that would help also. Because unfortunately, to try to find a therapist or a nutritionist outside who accepts insurance has been quite difficult in the recently.
100%, which is super unfortunate, right? We wish our healthcare system was more approachable, but we do take most insurances, including Medicare and Medicaid, which is fantastic because most programs don't.
Not only do most programs don't, but there's very few programs around the area that actually even do the eating disorder. If I contact the local hospitals nearby, almost none of them have anything even related to it, and they all tell me send them to an outpatient therapist.
Yeah, unfortunately.
And so by having this eating disorder clinic, it makes it much easier because, one, I've got the team approach to it. 2, I've got easy contact with them. And 3 is I can get them into something sooner rather than to have to try to do this on my own with much less knowledge than the two of you have.
Yeah, the unfortunate nature is that there's not many practitioners, both therapists and dietitians, that specialize in eating disorders. So it's great that we have multiple levels of care, that they can stay in one place, know the same general team, and get continuous care.
Which is why it's important that in this area, if people understand that RWJBH has this eating disorder clinic, has the availability, has supported it, put money into this, generated stuff for this in order to help patients in a community setting also. They don't have to be rushed over to Philadelphia or Manhattan and to try to even do that, because especially, if they're going to be outpatients, to try to be running into Philadelphia or Manhattan all the time, it's not going to work. In a community setting such as this, you've got you guys, you've got the social services, the OT, the PT, which is community-based, so they'll be able to follow up and do things appropriately.
Mm-hmm. And we also have medical staff if needed. We have GI, we have PT, so if additional services are needed, we can provide that. Again,
important, the fact that it's all here, all related, all part of the team, and each one can bounce things off of each other so that if someone does have an eating disorder, we can hopefully do something.
Yep. We address it from all angles.
So as we get close to concluding our show, what are the key messages you want to leave our audience about eating disorder services at RWJBarnabas Health?
So I would say, just to remind everyone, eating disorders are serious illnesses. And like Amanda was saying, early identification and intervention is so paramount, if at all possible, to get your child or family member in here for an evaluation. And at least the minimum we can do is set someone up with outpatient services, or we can see what else is available and what's most appropriate. But we're here, we're a compassionate team, we love what we do, and we're here to help.
Thank you, Christine. Amanda, anything to add to that?
I think she got it all.
Well, thank you both for being here. Thank you for what you do for RWJBarnabas Health. Thank you for doing something that very few others are doing in this area or even around the country. Having an eating disorder clinic that has team membership, team care, and team compassion in order to help improve the lives of our patients, our teenagers, our adolescents. Thank you for everything you do for our community.
Thank you for having us.
Yeah, thank you so much.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about RWJBarnabas Health's eating disorder services, please visit us at www.rwjbh.org/eating disorders.